IXL and what you can do as a parent to make it better. So I'm going to present my screen now. Um, through all the features because if you are a parent of a student at MS390, they know very well all about IXL and how it works and how to use it. So, from a teacher's standpoint, the two biggest benefits of IXL, we've been using it for this third year now, is the engagement factor. The kid can earn rewards for all the questions that they answer, and if they just stare at a screen, which they all love to do. But the differentiation is the biggest thing, and I'll talk more about that in a minute, because it puts the student in control a lot more of their own education than just teacher-directed lessons and everything. They have a lot of choice. They can really go where they want to, and how far they want to is really all up to them. This year, I'm teaching 601, sixth grade, 602 math. I had them do 20 minutes a day because that's really all it takes to make a difference. You don't want to overload them with too much IXL. You don't want them to get sick of it. And I find that 20 minutes a day, just as a reminder of the lesson that they learned that day in school, makes enough of a difference. All right, as a parent, I'm gonna show you a student's account in a bit, but the biggest thing you can do is just ask your child. First of all, if they did their IXL today, again, this should be about 20 minutes, and then ask them to show you. They can show you their dashboard. I'll show you in a minute what it looks like, so you know what to expect and what to look for. Ask them what they worked on, even if it's something that you're not familiar with, as long as they can verbalize and tell you what they actually worked on, that's a good sign. And you want to ask them what their SMART score was today. And then depending on that score, that's going to determine where they go next. So I find that as a parent, these 4 questions make a big difference in how much you get involved with your kids' education as far as IXL is concerned. So the SMART score, if they are struggling, if they don't get it, and they're getting something like less than 70%, a low SMART score, what they can do is find a related skill on a lower grade level. And of course, there's no shame in that. IXL actually recommends, after each question, they will recommend a skill that they can work on as a prerequisite that they can master until they're ready to tackle the grade level skill. If they get a SMART score of 90 or above, that's definitely very good. And then what they can do is find a related skill on a higher grade level to go beyond what they're learning now. That goes back to the differentiation. That's the biggest thing about IXL. If they're not ready, IXL has thousands, literally thousands of skills that they can work on in order to get ready. And if they are ready to go beyond, IXL is ready for that too. They have everything from pre-K all the way up to calculus. So this is a student's account. I know Gabriel is here at the meeting. I'm sorry, Gabriel, I didn't want to use your account because you have gone way, 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 way beyond anything, and I didn't think it was a realistic picture of the average student. So there are 3 tabs up here: learning, diagnostic, and analytics. So we've been using IXL with math. This is our 3rd year doing it. If you look at your child's screen, as you can see, it goes all the way from pre-K through 8th grade, and then beyond that, algebra, advanced geometry, harder algebra, pre-calculus, and all the way up to calculus. So there is really very little limit in terms of what they can do. Now, you click on a grade level. I'm going to do 6th grade because that's what I teach and that's what this student is in. You see all the topics that they have, all the topics we're covering in 6th grade, and then you can see their scores right next to it. For example, very first one, whole numbers, place values, she got a 95 in that, okay? If there's no score, that means they haven't done it yet. But some of the things we were working on before the world changed was equation. So she did very well on that. So if you want to just take a look at the learning tab on your kid's iPad, log into IXL, they're probably signed in already, and then check that out just to give yourself a good overview of what they have done, how many things they have completed, what they're working on, and also what they have not done. Geometry was also a big topic this year. So you can see she's done a lot in geometry, all right? A lot of them are still in progress. But that's another good thing about IXL. You can put it down, walk away, and come back when you're ready. And you get to pick up right where you left off. So the most important thing I want to show you today is the analytics. Now, all you have to do to get a sense of where your child is at is click on this analytics, and it tells you all about how much they have been using IXL. For this student, in the last 30 days, she has answered 406 questions. She spent 5.5 hours on IXL and made progress in 24 different skills. And then they break it down. They show you exactly what they're working on and what grade level. These 5th grade things I assigned to get them ready for this unit that we're trying right now in statistics. So I assigned a bunch of 5th grade skills to make sure that they had a basic understanding. And then you have this bar graph over here. It used to say when they worked in school and home. But now, since everything's different, they changed it to weeknights and weekends and then weekdays. So this was kind of like the school tab and this was the home tab. So we could tell what they were working on in school, and then the blue would be how much they're working at home. So this is your best friend if you want to get involved and see exactly how your child's doing with IXL. The analytics tab, all right, gives you all the usage. And then you can also, you want to focus on certain grade level, you could do that. And subjects, now we have IXL for all subjects. It used to be for just math, and now we have it for ELA, science, social studies, everything. And then this is also handy. If you want to check your child's progress, see if they did their homework, just go to today. And it will show you what they've done today. Today, Emily has answered 42 questions. She's doing some 7th grade work. These are things that I didn't even assign, so that's good. She's taking initiative. It even tells you when. But you can adjust this to anything. You saw you can do 1 week, last 7 days, and look for the trends. You can see what time she's doing it, what skill she's working on, and also you can get the grand total. All 390 students will have access to IXL as long as they're in 390. So over the course of 6th, 7th grade, you can see exactly how it builds up and all the things that she's learning. 83 different skills and almost 40 hours of her life has been spent on IXL improving. All right, mostly in math, but now, again, they just started with other subject areas. Now, if they are struggling, I'm going to go show you a quick demonstration of what IXL will do for that student. Okay, let's go to math. Now, all the teachers at 390 have spent a lot of time. We had a couple meetings that we all worked together, all grade levels. We worked on a giant spreadsheet that was kind of like a map of everything that's connected. So if a student in 6th grade is having trouble with something to do with equations, we connected it to all the other skills on IXL, going down and up. So if they're doing really good, we figured out what their next step is. And if they are struggling and they're not ready for it yet, we outlined a couple of things that they could do on lower grades as far back as they need it. That's the beauty of IXL. It meets you where you're at. And if you're not ready, it will give you something to get ready. So I'm going to show you real quick. Let's try this. All right, percentages is a big topic in 6th grade. So the student will click on a topic and a subtopic. All right, and they're all equipped with their iPads to write in the answer. And after every question, or if they are not familiar with something, this is what IXL does. If they're not ready yet, this can help, and it'll direct them towards another skill, okay? As far back as they need to, going down to 3rd grade in this example. So sometimes they'll take them back to maybe 5th grade or 4th grade, and if they're still struggling, they'll take them back even further, and then build them up through the grades until they're ready. So that's the best thing from a teacher standpoint about IXL. It meets the students where they're at. It shows them what to do if they're not ready yet. And then, of course, they can always go beyond, all the way up to calculus whenever they're ready. All the teachers at 390 are very familiar with IXL, especially the math department. The other subjects just started working on it recently. So if they have any questions or struggling at any
for
point.
language arts, so they're also able to, you're also able to track their progress in IXL in language arts, because they're able to practice some skills there, and they're assigned a specific skill every single day. Most of our students in 601 and 602 have mastered many of the skills, and now we're moving on to social studies in IXL. So congratulations to all 601 and 602 students.
Yeah, so the 20 minutes a day is really all you need. And I guess to answer the question from before, you would have to go to the actual website, not through the app, to see all their analytics.
Okay, this will be like a good option for the summer. Right now, because we're doing remote learning, it will be too much screen time for the kids to be able to do their work for the school and also do IXL aside from it. So, but during the summer, that will be a great option to do it, to maintain their levels. And like we mentioned, it also has ELA, it has social studies, science, and the Spanish one. Mr. Paquiana,
Yeah.
do you have anything else to add so we could finish with your segment?
No, that's about it.
All right. Well, we thank you very much. It was a great presentation. Mr. Barrios, are we having Ms. Rosendo? Dr. Rosendo, are you still with us?
Yes, can you hear me?
Yes. Yes.
Good afternoon, everyone. This is Sandra Rosendo, the medical provider at your children's school clinic. I hope everyone is doing well and taking care of yourself during this, difficult times, adjusting well. I would like to inform you that I am providing medical services via telephone. We are doing telehealth, which is basically speaking to a lot of our patients over the phone and providing, care. So if you need to speak with me, you can reach us. You can reach me or any other medical provider at Morris Heights, the call center. Their number there It's 718-716-4400. And you can request to speak with me, but if I am not available, they will connect you with any other pediatric medical provider to meet your need. So I will be putting that number and that information, my contact information, down on the chat. So don't worry if you didn't take the number, but I just wanted to let you know that that I'm available, and that if you have any questions, I will try to answer them to the best of my ability.
Do we have any parents that have questions for the Dr. Rosendo? Questions regarding health or whatever you would like to know? Dr. Rosendo, I have a question for you.
Sure.
How does the virus travels from person to person, and where can it hide in the body so that the transition from one person to the other is easier?
So this is a virus, right, that is transmitted via droplets. So it's mainly spread when you're in contact with someone at a very close distance, and and you are basically, in touch with your eyes, your mouth, your hands. So hence the social distancing protocols that were put in place is to basically maintain a distance with anyone of 6 feet in order to prevent the spread. Also, the hand washing, because a lot of times we're touching millions of surfaces that are contaminated with this virus, as well as other viruses, and basically is the doorknobs, tables, computers, phones. So when you touch them and do not wash your hands before you touch your face, that's basically what increases your risk of becoming infected with this fatal virus for some people. So that's why it is crucial that we are washing our hands, that we are teaching our children how to stay safe by washing our hands with soap and water for 20 seconds, making sure that we're scrubbing the front and the back of our hands and under our nails, so that we remove as much dirt and contaminants from our hands. That we also try not to touch our face, and I know that is very hard, including for adults. So it's important that we show our kids by example how to not touch our face and wash our hands frequently.
Doctor, so if somebody comes from the street and goes to the house, right? This person takes a shower, right? It's totally protected or washed off the virus.
Yes, it is recommended that soap basically destroys the outer layer of this virus, and that's why soap is so important in order to destroy this virus. When you come in from outside, it's important that I mean, it depends, right? Many people have different strategies in place as to minimize the contact of the to the outside world and your home. But if you can't, remove your clothing, put them in the washer to wash and dry with the heat, so that this virus can be killed, and you can shower, change into your regular clothes before you go and hug your loved ones. I think that's definitely going to minimize your exposure, especially for a lot of members that have not been outside since this pandemic began. I think that you are doing a very good thing for them in order to keep them protected. But if you cannot do these things, then hand washing and disinfecting anything that has been in contact with the outside will be ideal. And that's why it's important to disinfect with Clorox, use the Clorox wipes, or the any approved, FDA-approved disinfectant to clean and sanitize the most commonly used surfaces like tables, laptops, phones, and other computers that you are maybe sharing with your kids, you know. So it's important that you maintain a routine and structure as to how to keep everyone safe.
So a silly question. If somebody takes a shower, right, and it's totally clean, but then sneezes, where is the danger there?
Well, I think that, you know, I think there's not a silly question, but when you sneeze, when you cough, it's important to use the inner part of your elbow to cover your sneeze, because if it's not COVID, it's any other viruses that can be spread through, you know, your sneeze or your cough. So I think it's important to just put that into practice, that when you're coughing, when you're sneezing, that you cover your nose and mouth, and that if you touch your face or if you need to blow your nose, that you wash your hands afterwards.
So we have,
Hand hygiene is crucial.
thank you. So we have a question from Ms. Rojas here. She said that if you should cover your eyes and your hair too.
I think yes, because a lot of times we touch our eyes, we rub our eyes, especially with the allergy season. A lot of people are having itchy eyes, and you know that's one way. We have tissues there that can actually get contaminated with this virus. So hence the recommendation of wearing goggles or glasses that can protect your exposure. If someone was to sneeze literally on your face, you know, the germs could go through your eyes as well as through your mouth, but it's not, you know, it's not required to be wearing goggles at all times unless you are a high risk, you know, of exposing yourself with droplets.
We have another question here. That
Yes.
people who had the virus develop antibodies.
The majority of the people who have had COVID-19 infections develop antibodies. There are some people I hear that have not developed the antibodies and they have not been detected, even though they were sick at some point. However, what we don't know for sure yet is whether or not you're immune. What that means is that if you were sick with COVID-19 in April and you get tested for COVID-19 antibodies now in May and they are detected, we don't know for sure that you will be completely immune to COVID-19 to get infected again. So if COVID-19 follows the same viral etiology of other infections, many times you could be immune, but we don't know yet. I think that the experts are saying that there's no immunity cannot be secure, so I would not count on that. I would recommend that even if you were sick and you think you had COVID-19 and you have the antibodies, I would still recommend that you protect yourself so that you don't get sick again.
Okay, thank you. We have another question, and is how long does the virus stays in the air?
It depends on the surfaces. Plastic surfaces, they have believed that it can stay viable for like over 14 days, but that has changed, quite a lot. So I think that if you want specific information, you can go on the CDC website. They have a lot of information on the viruses, and as well as the surfaces where the viruses can live longer. So I think it's just in general, if you don't want to remember all the statistics, you can just remember to sanitize frequently as much as possible.
One last question. I know that I'm attacking you.
Go ahead. I'm here.
Parents are very much into it. So we have here why some people don't have symptoms.
Yeah, because this virus is pretty much, if you want to be, like very simple, this is just another viral infection. A lot of people are most in contact with viral infections like a cold, like the flu, okay? And your body is able to fight it off. And most of the times you won't even know it. The problem with this virus is that it is very aggressive for people who have, chronic illnesses, like heart disease, lung disease, and it tends to make those individuals more prone to develop complications as a result of this viral infection. Okay, so the majority will probably not have any symptoms at all, and yet because they were exposed with a family member or just from being outside or work related, exposure, then the body has that virus. It will fight it off, and you probably will not even know or be aware about that.
Is it different for adults than for children?
The symptoms nowadays, we are actually starting to see a variety of symptoms in both kids and adults. In kids, most of the times they can be manifested by abdominal pain, vomiting, diarrhea. But in adults, it's generally headaches, fever, cough. Okay, but now, since I've been back to work, I think I've actually seen a lot of those symptoms overlapping in adults as well, with abdominal pain, nausea, and just feeling dizzy and not themselves. So it is, there's a whole list of symptoms, but the most common are fever, headache, body aches, and sore throat, and then cough.
Okay, I'm sharing on the chat a link to the latest communication that the chancellor sent, talking about the new the Kawasaki syndrome. So
Yes.
now that we were talking about kids having symptoms, so I shared that on the chat right now. So before we finish, if you would like to go and click on the link, it will take you to that form that has all the symptoms. I'm sorry.
Okay.
Go ahead.
I think that, for small children, well, even for young adults, like anyone under 21, I think it's important to just monitor them, right? Because when you see any skin changes, any rashes that are accompanied by fever, body aches, chills, we need to assume that it's COVID related, and we need to call our pediatrician immediately. And if you are not able to reach your pediatrician, you need to call, 911 or bring them into the emergency room for care. Because now we have this inflammatory disease that is that is seen in children, that is very closely related to Kawasaki infection, and and it can be fatal. So I think it's important that you monitor your children. You know them best, and you know when something just is not right.
Yes. So if you have the time to click on that link that I put in the chat, it has all the information. Dr. Rosendo, thank you very much. We have another question.
Yes, there's another question.
I have heart failure, and is it safe for my family to visit me?
I would recommend that you speak with your primary care physician to get like a real clearance about that. But I think that anyone with heart disease or any chronic illnesses are at a high risk, in the high risk group, and therefore need to take these precautions very, very seriously. So I would recommend that there are no visitors. There's limit contact with people who may be carriers of this virus, but I will strongly encourage you to contact your primary care doctor.
Well, thank you very much, Dr. Rosendo. For now, I would like to thank those parents that've been here. I see some familiar names coming every week, and this is great because that way you could tell the other parents about the information that we share here. Now I see a lot of questions regarding graduation and report cards. Ms. Poe, are you around?
Yes, I am here. Hi, Mr. Duran. Good evening, everyone. Thank you for staying tuned. The last day for the marking period for June 5th, last day for marking period 3 for 8th grade, and June 12th, last day for marking period 3 for 6th and 7th graders. Regarding the moving up ceremony, we don't have the guidelines from the DOE. I learned that next week we will learn. So as soon as we find out for them which way we are going to materialize this virtual celebration, we will share the details with you. I am planning to call on for a conference with all my 8th grader kids on Friday, just to touch base on the video that they want to put together as something that they want to share. I also want to take this opportunity to ask 8th grade parents to have your kids record you a small caption or video sharing with us what have you learned from your kids during remote learning, on how the whole experience has been for you. We want to put together like a collage of videos from parents, anything you like to share with us, and we can use this as one of the pieces to present during the virtual ceremony. So any videos you make, you can send them directly to Mr. Duran or to myself, bpou@ms390.com.
All righty.
There is another question about summer school, so maybe Ms. Varona can answer this one.
Sure. So we received guidance about the summer program actually yesterday, and some more information today. So the plan for summer school so far, summer school is going to happen on July 13th to August 18th. So we would have 22 instructional days for the summer program. We will not have any enrichment or the STEM or Title III programs in the summer. So the summer learning program has been designated only for the students that have been mandated or recommended to participate in the summer program. It's gonna be from 8:30 to 12:30, and it's only for 3rd grade to 8th grade and the high school students.
Yeah.
So the last day of this school year would be on June 26th. So the students would have roughly 15 days off. And then on July 13th, the expectation is for those students that have been identified based on the grading policy as needs of improvement or course in progress, they will be participating in the mandated summer program. For the course in progress will be mandated, for the needs improvement would be recommended. And of course, based on the grading policy, those students that are meeting the standards, they are not required to participate in the summer program.
There's another question?
Yeah, parents will be notified once we get the recommendations from the teachers. You will be receiving a phone call and an email as well if we have your email.
Mm-hmm. But again, parents, keep in mind that this is how much we know so far up until today. It may change, things change every day. As we are getting the information from other DOE, we will share it with you.
One more question. Are the summer program mandatory? Yeah, summer school will be mandatory for students recommended to take the additional academic support over that time span, July 13 to August, because it's the only way, especially for 8th graders, to ensure or somehow not so much ensure, but to help them get ready for 9th grade. 9th grade curriculum is a different monster. It has nothing to do with 8th grade curriculum. So the more we could do to help our kids to get ready for 9th grade, or for the next grade in general, the better off they will be.
There's another question. Are the children going to have the same teachers? We hope so, but again, the summer program is not mandatory for the teachers. The teachers apply, and it's based on interest. Some teachers, they are not interested in working in the summer program, and that is perfectly fine. While others, they would prefer to continue working and work for those 22 days of the summer program. So we still don't know. I know that the DOE sent out a link that it was malfunctioning. So in reality, our teachers have not been able to apply to the summer program yet.
We have another question regarding the iPad. The question is that the iPad is not charging. If we could check it out, and the answer is no. We could check out whatever happens with the system. We could do it remotely, but something physical of the device, we are not able to fix it. However, we ask for those parents that would like another device to apply to get another device through the city. I'm gonna get the link and put it in the chat later on.
Are we going to be in school for the summer school?
No, we're not. Summer school is going to be virtually, remotely. The same format, the same platforms that we are currently using.
Okay, Ms. Ceballos, you want to?
Yes. Thank you so much, everyone, for hanging out with us and joining us every week. In addition to provide you information that you might need, we also use this platform to give you some information about social distancing, hygiene, or sanitizing, and hand washing. So every week we want to touch upon this because we have to be ready to come back in September, and unless we all educated in the importance of protecting ourselves and others, we cannot do it. So since there's already time, we have a very short 20 seconds video for you to watch about hand washing. Believe it or not, it's very important that we do it correctly. And then we're gonna close with that for the day. If you have or you need additional information, please don't hesitate to get in contact with us. Thank you.
Before we show the video, I would like to give you some information that I have here for you. I'm putting the link on the chat. Hold on a second. Let me show you first. So this is the website.
Yeah.
They have all the information that you will need about. It has health information, access to food. So it divides it by neighborhood. All of those links are things where you could get food. The access to the cell phone that I gave last time is on this website. Housing assistance, rental, utilities, free health services. The list is humongous. So I'm gonna copy this link and put it on the chat, so that way you could, whatever service you need from there, they have all the information, the phone numbers, and everything. So thank you to all the parents to show up. You know that next Wednesday we do it all over again. We're gonna have other guests. Or if you want the same guest, I'm pretty sure everybody wants to hear from Dr. Rosendo every week, right?
Thank you, Rosendo.
Mr. Duran, if parents have any ideas for future topics that they would like us to discuss during this meeting, please put it on the chat.
Yes, please. So we wanna be able to give you all the information that you need, that you would want. And also, I forgot to mention that from the beginning, that there are some parents that are not able to make it at this time. So, if this time works for you, please let us know. So let us know what's the best time for us to reach you. All that we want is to be able to have your ear for hopefully half an hour. We always aim for half an hour, and we have an hour already. But it's a lot of information to put together. So, well, thank you very much. If you want to hang around and ask questions individually, you can do so. But we have finished the meeting now. Thank you for your